Calling the joint hearing on the Committee on Human Services and on Health. This is the February 9, Tuesday, 3 p.m. calendar. Present for the Committee on Human Services is myself as Chair, Joyce Ann Buenaventura, my Vice Chair, Senator Les Ihara, on Zoom conference, Zoom conference, I see Senator Ocasio, and for Health Chair Kyoho Kalole, who is present. I can call you folks in as present too. Okay, I see Chair Kyoho Kalole.
Yes, I'm here. Thank you, Chair. And I'm joined by my Vice Chair, Senator Baker.
Okay, so this meeting, including the audio and video of remote participants, is being streamed live on YouTube. You will find links to viewing options for all Senate meetings on the live and on-demand video page of the legislator's website. The Zoom meeting and YouTube live stream will include the following agenda, which is the Tuesday 3 p.m. calendar and the 3:05 calendar for Human Services, joint by Health Lead and Human Services co-lead. And the second is, in the unlikely event that we have to abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding businesses at next Tuesday on February 16th at 3 p.m. at room 225, and a public notice will be posted on the legislative website. For the people participating remotely, all testifier audio will be muted and video disabled until shortly before it is your turn to testify. Although no time limits are going to be done, because we do have a full agenda and because it is a dual committee, I do ask all witnesses to be brief. If you can rest on your written testimony, do so, and or summarize, but do not repeat your written testimony. Assume that we have read your written testimony. Okay. If there are any unruly testifiers, your audio or video for that person may be cut so that we can move on. Okay, I think I've wrapped up all of the statements, and I'm ready to proceed. So first up is SB 199, relating to assisted community treatment, mandates appointment of a guardian ad litem to represent best interests of a mentally ill individual in assisted community treatment proceedings, and eliminates the need of the Office of Public Defender to participate in the proceeding. First up, testifying for the Office of Public Defender. Are you present, Public Defender?
Yes, I am.
Okay.
Thank you. At your request, the Office of Public Defender will stand on its written comments.
Okay, thank you very much. Next up, Rosie Davis for Huli Aola in support.
Hi, Chair. I'm so sorry to interrupt. We're going to have to call a recess.
Okay, recess. Joint committee hearing at
Senator,
Tuesday.
sorry, we need to give you the 5-second count.
Okay, thank you. Recalling the 3 p.m. calendar on Human Services and Health. And we are in the middle of receiving testimony on SB 199. I thank you for your patience. We had technical difficulties. After the Office of Public Defender, we had Rosie Davis testifying for Huli Auola in support. Is Rosie Davis present? Okay, next up is Connie Mitchell for IHS in support. I see that she's present. Please proceed.
Thank you, Chair. Senators, I just wish to say that I'm speaking on behalf of IHS, the Institute for Human Services. We've been doing a lot of outreach, and we actually are in very strong support of this bill, which would streamline, the process for us considerably. Sometimes it takes months, and one of them over a year this past year, and so we're really wanting to find ways to just make it possible for people to be treated more quickly. So we stand on our testimony. Thank you.
Okay, thank you very much. Okay, no one else has registered to testify in live support, so we have Judge Kuriyama testifying for the judiciary, comments, Attorney General with comments, Hawaii State Department of Health comments, Kimo Alameda for Bay Clinic and support, Hawaii Disability Rights Center comments, Hawaii Substance Abuse Coalition in support. So, I saw Alan Johnson there. Did you want to testify, Alan Johnson, for Hawaii Substance Abuse Coalition? You didn't register,
We
but
stand
you're
on
there.
our support. We stand on our testimony and support.
Okay, thank you very much. Okay, David Gerlach for St. Elizabeth's Church in support, Ohana Health Plan in support, Habitat for Humanity in support, St. Michael the Archangel Parish in support, another person from IHS in support, and 3, 4, 5, 6, 7, 8, 9 different individuals all in support. Anybody else who has registered or in the Zoom conference who want to testify? Okay, seeing none. Members for Human Services, any questions? Okay, Health? It doesn't look like any members of Health Committee have any questions. So we're moving on. SB 819, relating to Hospital Sustainability Program. Extends the Hospital Sustainability Program through June 30th, 2024, increases the maximum fee for inpatient care services to 5.5%, increases the amount of time hospitals have to pay the hospital sustainability fee from 30 days to 60 days, increases the pool of Medicaid services that can be used for matching funds or otherwise appropriating funds. Okay, testifying in support, Department of Human Services. Are you present? Oh, I see Judy Moore-Peterson.
Hi, good afternoon. Thank you for this opportunity to testify on behalf of this measure. We are in strong support. We offer a few technical amendments. Thank you.
Okay, thank you very much. Next up, Hilton Bethel Healthcare Association of Hawaii in support.
Yes, thank you, chairs and senators, for the opportunity to testify in strong support of SB 819, which authorizes a hospital sustainability program for 2 additional years. By assessing a tax on private hospitals, we're able to bring in meaningful federal dollars without any general funds. We've worked closely over the past few months in collaboration with the MedQuest division on this program. And the program this year will levy additional taxes on the hospitals to help fund Medicaid programs. We look forward to continuing our work with MedQuest and look forward to and ask for your support in passing this bill. We would like to note that the hospital sustainability program is different and separate from the proposed insurance tax programs, and we do not have any involvement or position on legislation related to that proposal. Thank you for the opportunity to testify in support of this bill.
Okay, thank you very much. Okay, next up who registered to, is Queens Health Systems. In support, Colette Masunaga, I see you present.
Aloha Chair, Vice Chair, members of the committee, Colette Masunaga with the Queens Health Systems. You have our written testimony, so we will just stand in strong support of this bill and concur with the testimony provided by HTH and Hilton. Mahalo.
Okay, thank you very much, Colette. And, okay, nobody else having registered to testify in Zoom who have provided written testimony is Hawai'i Primary Care Association in support, Hawaii Pacific Health in support, Kaiser Permanente in support. Anybody else on Zoom wishing to testify? Seeing none. Questions, members? From Human Services? None. From Health Committee? None. I also do note the presence of Senator Favela for both Health and Human Services Committee. Okay, seeing no questions, we're moving on. Okay, last bill for the 3 o'clock agenda is SB 820, Nursing Facility Sustainability Program. Extends the Nursing Facility Sustainability Program to 2024. Allows the Nursing Facility Sustainability Fee to be used to enhance capitated rates for the purpose of paying quality incentives. Specifies that the nursing facility sustainability limit is 5.5% of overall net patient service revenue. Removes the per resident daily maximum fee of $20 for each facility. Specifies facilities that meet certain expectations shall pay a reduced daily fee in comparison to other participating facilities and otherwise appropriates funds from that sustainability fund. Okay, first up, I see Judy Moore Peterson for Department of Human Services in support.
Thank you very much again for this opportunity to testify. We stand on our written testimony in strong support. I will also note that we do agree and concur with the proposed amendment that HTH has. Thank you.
Okay, thank you very much. Okay, next up, I see Hilton Rathel for Healthcare Association of Hawaii, also in support.
Thank you again for the opportunity to testify in strong support of this bill. Like SB 819, which supports hospitals, this legislation helps to ensure that our long-term care facilities have the resources they need to provide care to our kapuna. As with the hospital program, this program draws down federal funds without using any general funds. We ask for your support in reauthorizing this program for an additional 2 years and look forward to continuing our close work with the MedQuest division on this program. Thank you for the opportunity to testify in support of this bill.
Okay, thank you very much. Okay, next up, I see Colette Masunaga, Queens Health Systems in support.
Aloha Chair, again, Colette Masunaga for the Queens Health Systems. We'll stand on our testimony in strong support. Mahalo. Okay,
thank you very much. Okay, nobody else having registered for the Zoom conference, but those who have provided written testimony include Ohana Pacific Health in support, Hawaii Primary Care Association in support. Anybody else in the Zoom conference who wish to testify on SB 820? Seeing none. Members, any questions from Human Services? For our Health Committee? Okay, seeing none. That being, oh, I'm sorry, there's one more. Okay. Okay, next up, SB 900, relating to maternal health, requires the Department of Human Services to collect and report data on severe maternal morbidity incidents disaggregated by county, race, and ethnicity, establishes a maternal disparity and health equity task force to make recommendations on reducing maternal morbidity and improving maternal health outcomes for women, particularly women of color. Requires a task force to submit an initial report to the legislature no later than June 30, 2022, and an annual report prior to each regular session. Requires the Department of Human Services to develop and the Hawaii State Commission on the Status of Women to administer implicit bias training for healthcare professionals in perinatal facilities. First up on SB 900, testifying for Department of Human Services, comments. Is that you, Judy?
Is this for the, did you say?
This is for the
Okay, I'm
morbidity
sorry.
rates.
I missed the comments part. I thought you said something else. I do apologize. Good afternoon. Thank you for the opportunity to testify on this measure. We stand on a written testimony offering comments. Well, we appreciate the intent. Thank you.
Okay, thank you very much. Okay, next up, Department of Health comments. I don't see, okay. Next up, Hawaii State Commission. Oh, do we have Department of Health?
Thank you, Chair. Matthew Shim, Family Health Services Division, Chief, Department of Health. The department stands on its written comments and is available to answer any questions. Thank you.
Okay, next up, Hawaii State Commission on the Status of Women in Support. I don't.
Thank you, Chair and honorable members. Very quickly, our understanding is, this is in support, our understanding is that this bill came from community-based organizations who do all of the support work in between, formal doctor visits and hospital visits for pregnant and birthing women and people. And we, feel that the state ultimately bears the primary responsibility to address medical racism that has been acknowledged in data from our community members and also from our health industry professionals as well. So we are proud to support this bill and able and willing to participate in addressing the issues and crisis raised by legislation. Thank you so much.
Okay, thank you very much. Okay, next up, Queens Health Systems, Colette Masunaga, comments.
Aloha, Chair. You have our written testimony, so we'll just stand on our comments in supporting the intent of this measure. Mahalo.
Okay, thank you very much. Okay, next up, Aloha Care, Tricia La Chica, in support. Okay, I don't see her. Okay, next up, Healthcare Association of Hawai'i, comments. Paige.
Hi, good afternoon, Chair. Thank you so much. We will stand on our comments and we'll just note that, we really appreciated working with the Department of Health on their maternal and child health reviews. We have been an active participant in a number of those initiatives, and would just note also that we've really appreciated the leadership of MedQuest through our quality program that we actually run through the hospital sustainability program. And that group is actually meeting on Thursday to discuss key measures and note our progress on improving maternal health in the state. Thank you.
Okay, thank you very much. Okay, nobody else, excuse me. There is a Yvonne Mahelona in support. Yvonne? Okay, next up. Aloha. Yvonne, could you, oh, terrific, you're here.
Hi, aloha senators, o wau o Yvonne Mahelona, no nanakuli mai au, no ho'au ma ka mo ili Honolulu, o mauna ke a ku'upiko, o ana o io ka a'a o nanakuli ku'upoko. I am a Kanaka birth worker, a midwifery student. My official title makes me a perinatal health support person. I'm also a community organizer for a grassroots feminist organization and a kia'i. All of these things makes me a defender of all that is sacred. So I'm testifying in support of Senate Bill 900 because though there may be groups or stakeholders whose umbrella this work fall under, the time for these conversations to turn into action was way too many yesterdays ago. We need a task force that focuses solely on maternal morbidity and maternal health equity, which centers community experiences and voices and not just that of healthcare professionals and stakeholders. I do want to say that spaces like these here at the legislature, as well as doctors' offices and birthing rooms, are both intimidating and not easily accessible for Black, Kanaka, Micronesian, and other Pacific Islander people, even more so for our moms and birthing people. Keep in mind that the voices and actual experiences of your community and constituents is the most imperative part of your job, and of what progress looks or doesn't look like. I've learned that alliances and acronyms amongst healthcare professionals and community orgs, maybe even some state agencies have been talking about doing, maybe kind of doing part of what is mentioned in the bill, desegregated data and requiring implicit bias training. Community doesn't see that. including community voices, also wasn't a part of or isn't a priority. There was no clear answer about what is being done currently, though what I did hear is that they'd rather not have it legislated or required, but incentivized. While these conversations are happening, reality is also happening, and our Black, Native Hawaiian, Micronesian, and other Pacific Islander mothers and birthing people are still not receiving adequate prenatal care, and we're dying. This bill has now pushed these conversations to the forefront, but what I'm also seeing in the forefront is that there has been no sense of urgency to address, get clear about, and actively combat what maternal morbidity actually looks like for Native Hawaiians, Micronesians, and other Pacific Islanders. All we do know is that compared to white women, our moms and babies are 60% more likely to die in the hospital. We are 4 times more likely not to receive prenatal care or support. Going back to my point of these spaces being intimidating. A fellow Kanaka birth worker, Wahine Hula Ka'eo, said that birthing for mamas and birthing people of color in Hawai'i is treated more like a medical emergency than the sacred experience it is and should be. Women and birthing people have been birthing for thousands and thousands of years, and the only thing that has changed is the systems that serve us. Not to say that Western medicine doesn't have a place, because it does. There's life-saving work surrounding birth and reproductive health that come from Western medicine, though we cannot deny that the ways they came to be are inherently racist.
Yvonne, can you wrap up? We have a lot of supportive testimony. So you're not the only one saying about all of these things, so we need you to wrap up because we have other bills.
Mahalo. We care about having healthcare professionals and stakeholders listening to the conversations happening on our table instead. We care about healthcare professionals and stakeholders who touch our moms, birthing people, and their keiki being able to really see and honor us, who are the ones they are caring for. Implicit bias training is what the bare minimum we are demanding. We care about seeing more accurate data to show these healthcare professionals and stakeholders the way in helping us build safer futures and experiences as mamas and birthing people of color. Behind me today is a pareo, and the print on that pareo is a peva. Peva is the pieces of wood that Kanaka woodworkers use to mend cracks in the umeke. We wouldn't waste or throw away the umeke. What I'm saying here is mamas and birthing people are the umeke in our communities. They birth the next generations, working class, and future constituents of this very legislature. Kanaka and Black birth workers who serve the communities we are part of are the PEPA. Healthcare professionals and stakeholders should also want to be the PEPA.
Okay, so Yvonne
is the PEPA, and in Ike Kupuna, it's anti-racism, and sovereignty is the starting and ending point of equity or equality.
Yvonne, so thank you very much.
These are all overdue and also the bare minimum. Mahalo for your time, and I hope you all listen.
Okay, thank you very much. Okay, next up. Madeline Sese Parvasa in support. Madeline, are you present? Okay, next up, Sky Connolly in support. Okay, next up.
Present.
Oh, Sky, are you here?
No, I'm sorry, she's not present.
Okay, thank you. Okay, next up is, hold on. Tanya Smith Johnson, I see you're here. In support. Tanya?
Yes, I'm here. Thank you, chairs and committee members for allowing me to speak. D+, that's the grade Hawaii has from the March of Dimes 2020 report regarding preterm birth and maternal health outcomes. So no matter what any expert, bureaucrat, department says here today, the fact remains we are failing. We're failing mothers of color particularly. But let's be specific, because specificity matters. We are failing Black, Native Hawaiian, and other Pacific Islanders. And I have to say other because we don't separate out the data well enough to name them all. They go unseen. We should be ashamed of ourselves. I know it's the job of those responsible to try to make their department or group look good, to say they're already doing the work, they're in collaboration already. They don't necessarily want community at the table as we asked in the task force. They will say we got it, but numbers don't lie. Black people make up only 3% of the population in Hawaii, but Black women in Hawaii are 24% more likely to have a preterm birth and a baby born too soon than any other group here. So when will we address the other pandemic? If we treated this like COVID, we'd understand the need for a task force specific to the issue of equity and disparities. We'd understand and want to collect better data. We'd want to understand how we make it better. National leadership just released yesterday a federal bill package called the Black Omnibus Package. I'm happy and also sad to say Healthy Mothers, Healthy Babies is the only local organization in Hawaii who signed on to endorse that. And sad to say that many of the organizations and departments here had no clue about it. But to quote the introducer, Senator Cory Booker, and the former introducer was Kamala Harris, our new vice president, he says, we simply cannot continue to accept the status quo. So what are we going to do? Do we want to wait until departments show less apathy and more urgency and more specificity? While we wait, we continue to fail. And Black, Native, Pacific Islander birthing people and their babies deserve better than that. Lives are in the balance as we wait. Lives are in the balance as we wait for departments to get it together and to decide whether they're going to do anything, what they're doing, when they're going to do it on their own terms. Please pass SB 900 so we can make this happen immediately.
Okay, well,
for your time.
Thank you so much. Okay, next up is Sunny Chen in support. I see Sunny Chen.
Hi, thank you so much for the opportunity to testify. I stand on my written testimony in strong support. Without proper disaggregated morbidity data, we're throwing darts at our programs with no target. Women come to us with the wounds deeply scarred by their pregnancy, birth, and postpartum experiences, and we need to hear them. People have said to us that the data is complicated, or that we have been working towards it, or that implicit bias training might be a good idea. I'm here to tell you that the situation is dire in Hawaii as it is in the rest of the country. We need to make women's health a priority, take concrete steps to face racism and bias in healthcare, and provide community with accurate information. This will help us improve our understanding of the burden and impact of maternal morbidity. Supporting this measure tells community and the country that we are paying attention and Hawaii mothers matter. Thank you so much.
Okay, thank you very much. Okay, no one else having registered to testify, I'd like to point out we have a lot of testimony in favor. Office of Hawaiian Affairs in support. Planned Parenthood votes Northwest and Hawaii in support. Hawaii Children's Action Network in support. The Affirm Hawaii in support. Papa'ola Lokahi in support. Hawaii Women's Coalition in support. Healthy Mothers, Healthy Babies Coalition in support. ACOG in support. 1, 2, 3, 4, about 40, about 60 various other individuals, all writing in support and one person writing with comments. Anybody else on Zoom wishing to testify on SB 900? Seeing none. Human Services Committee members, any questions of the people testifying? None from Human Services. From Health, any committee members? Okay, seeing none, we're moving on. Okay, next up, SB 1285, medical facilities, requires any hospital or other medical facility that serves a community, including more than 500 COFA benefit recipients, to establish diversity and inclusion training for all staff and to hire interpreters and community healthcare workers as necessary to bridge the language and cultural divide with the community. Okay, first up, Queens Health Systems, Colette Matsunaga, comments.
Aloha, Chair. Mahalo. You have our written testimony, so we'll stand in our comments supporting the intent. As you all know, we here have the Queen Emma Clinic that serves over 700 COFA patients annually, and so while we appreciate the intent, we do have some concerns with the bill in the current form. Mahalo.
Okay, thank you very much. Next up, Healthcare Association of Hawaii, comments. Paige.
Hi, thank you, Chair. We'll stand on our written comments. Similar to Queens, appreciate the intent. Culturally competent care is important to our members, but there are some concerns about the resources that would be required for this measure. Thank you.
Okay, thank you very much. Okay, next up, COFA Alliance National Network in support, David Anitok. Are you present? David?
Aloha,
Aloha.
chairs, and members of the committee. It's an honor to be with you today. My name is David Anatok. Yakwe, Rananim, Lenwo, Kazalelia, Mokatin, Sulang, and Ali for this opportunity to join you today. This bill was produced by our support of our Senator Drew out in Big Island after meeting with Senator Drew. And we have a fast-growing communities in the rural areas of the Big Island and throughout the state of Hawaii that while they've been receiving services in many of the medical facilities, still need to address the gaps, especially in the health services around many of the different barriers and the systematic difficulties to navigate the system. But one of the top peak issues has always been continuing is the language barrier and the multicultural diversity of the communities to serve. And we're hoping to get, again, more resources towards the community. As said before, communities of color, Pacific Islanders, namely the Kofa Islanders, having to face difficulties during this pandemic has only exacerbated the issues that we need to step up and do more. We appreciate all the good efforts for many of our good healthcare facilities and providers, but we need to do more. We want communities to be involved, more involved with these entities.
Okay, thank you very much. Next up, Hawaii Coalition for Immigrant Rights and Support, Liza Ryan Grill. Liza?
Thank you, Chair, and thank you, chairs and members of the committee. Liza Ryan Gill with the Hawaii Coalition for Immigrant Rights, and we will stand on our testimony in strong support of this bill. We have seen throughout this pandemic how critical it is that our Kofa brothers and sisters in our state receive accurate information through in-person interpreters and community workers, and we also saw the deficit of those persons and hope to move this bill forward. Mahalo.
Okay, thank you very much. Next up, Catherine Chen in support. I see Catherine Chen.
Hi, thank you, Chair and Senators, for the opportunity to support SB 1285. I stand on the submitted testimony of the Hawaii Coalition of Immigrant Rights, which I co-signed. I will just add that the community experiences how the system currently does not work every day, and every day I see how much my COFA status colleagues, as well as my clients, contribute to the state, so I strongly support this step towards health equity for everyone. Thank you.
Okay, thank you very much. Okay, next up, Neil Palafox in support. Is that Neil?
Yes, I'm here. Thank you, Senator. I timed this. This will take two minutes and 10 seconds. My name is Neil Palafox. I work for the John Burns School of Medicine, University of Hawaii, and I'm on 4 COVID response teams for the state. The views of my testimony are my own and do not represent any of the institutions I work with. In context of the COVID-19 pandemic, SB 1285 is intended to, 1, increase the number of PI community health workers with language and cultural skills necessary for effectively working with Pacific Islanders. And secondly, to improve access and effective utilization of healthcare access services to PIs by creating a culture of zero tolerance for ethnic or racial discrimination in the health, education, and welfare systems of Hawaii. I am in full support of this bill, and at the Chair's discretion, I wish to make amendments to Preamble of SB 1285, which I noted in my written testimony. The suggested preamble highlights the policies and work that has already been implemented in the state regarding language access. The Office of Language Access ensures language translation to state-funded Hawaii and is codified under Hawaii Revised Statutes 321. There's many language translation services. Academic and community organizations are currently translating many brochures. Regarding ethnic and racial discrimination, I recognize that the U.S. Joint Commission of Hospital Standards articulates standards for health equity in the hospitals, and the hospitals has ensured diversity training and cultural competency in the training in hospital settings, and Hawaii Civil Rights Commission works to address public sector ethnic discrimination. However, during the pandemic, the continued absence of relevant community-based in-language and culturally informed translators who are connected to the community is problematic and dangerous. The hospitalization and death rate to COVID-19 is twice that of all other ethnic groups. Discrimination to the Pacific Islanders has become acutely visible in the healthcare settings. This bill is not a critique of what has been done to provide language access or to enhance cultural competency in the healthcare systems. SB 1285 intends to fill the gaps of what has not been done to increase effective PI community engagement and to address persistent discrimination in healthcare settings, to prevent the uneven burden of COVID-29 infections and death in Pacific Islander populations. Thank you very much, Senator.
Okay, thank you so much, Dr. Palafox. Okay, no one else having registered for the Zoom conference. Those who are submitting written testimony are Hawaii Civil Rights Commission in support, Attorney General with comments, Hawaii Primary Care Association in support, Hawaii Friends of Civil Rights in support, Papa'ola Lokahi in support, Native Hawaiian Pacific Islander Hawaii CV19 3R in support, Nations of Micronesia Waipahu Safe Haven Center in support, and we have various individuals, about 10 individuals in support and one with comments. Anybody else on Zoom wishing to testify on SB 1285? Seeing none. Members, any questions from Human Services? Seeing none. Health Committee members, any questions? Okay, seeing none. Since that's the last bill for this double session 3 o'clock hearing, I am going to put on recess for decision making. Okay, recalling the 3 o'clock calendar for Joint Human Services and Health Committee for decision making for SB 199. Chair's recommendation is to amend the appointment of Garden Lyon to include all MH1 patients and not just those for assisted community treatment, and add a defect date. Any questions, comments? Hearing none. Vice Chair for the vote.
Okay, this is a joint recommendation, yeah, with the other committee as well. And so we'll be voting on just the Human Services Committee.
Yes.
On the recommendations just stated by the Chair. Chair San Buenaventura.
Aye.
Senator Ihara votes aye. Senator Ocasio.
Aye.
Senator Misalucha.
Aye.
Senator Favela.
Aye.
Recommendations adopted.
Health Committee, same recommendation, SB1. Vice Chair, Chair votes aye.
Vice Chair votes aye.
Senator San Buenaventura.
Okay, thank you. You're not going to call it all of your... So Senator Favela for the Health Committee, are you going to vote aye? Okay.
Who's taking your vote?
Who's taking your vote?
All right, my apologies. I should be calling the rest of the. Let me do that now. For Health, Chair votes aye. Vice Chair votes aye. Senator Moriwaki. Excused. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's been adopted.
Okay, so for Thank you. For SB 819, Chair of Human Services recommendation is to accept the Department of Human Services amendments. Any questions, comments? Seeing none, Vice Chair for the vote for Human Services.
Human Services Committee members are voting on the recommendation to pass Senate Bill 819 with amendments, with all members present. Any reservations or objections? Otherwise, it's a unanimous vote. Recommendation is adopted.
Thank you.
For the Health Committee, same recommendation. Vice Chair, can you please take the vote? Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is still excused. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Your recommendation is adopted, Chair.
Okay, so, thank you. So for SB 820, Chair of Human Services recommendation is to pass unamended. Any comments, questions? Seeing none, Vice Chair for the vote.
We're voting on Chair's recommendation to pass Senate Bill 820 unamended. Any reservations or objections for the members present? The recommendation is adopted.
Health.
For the Health Committee, same recommendation. Vice Chair, can you please take the vote? Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's been adopted.
Thank you.
Okay, thank you. So for SB 900, Chair understands that there is a need to have this data from the numerous testimony in favor of it, and we understand that Queens and Papaola Lokahi is in fact reporting this data and already have better implicit basic bias training in their facilities. So in order for this bill to move past WHAM, we are going to remove the task force starting on page 5, line 16 to page 12, line 13, because that is going to cost us $150,000 and would surely kill the bill. So Chair's recommendation is to amend the bill by removing the task force, remove line 20, paragraph E on pages 14 to 15 to take into account Queens and Papaola Lokahi's better implicit bias training, but otherwise add a defect date, and that's it. Any comments, questions? Seeing none, Human Services for the vote.
We're voting on the Chair's recommendation to pass Senate Bill 900 with amendments as stated. Chair Senator San Buenaventura.
Aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Misalucha.
Aye.
Senator Favela.
Aye.
Recommendations adopted.
Health.
For the Health Committee, same recommendation. Vice Chair, the Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation has been adopted.
Thank you.
Okay, so for SB 1285 relating to COFA benefit recipients, recommendation is to accept Senator Kanuha's amendments in the preamble. However, we're also going to amend on page 2, line 18, change the term eligible for benefits to recipients of benefits to add more clarity. Also remove on page 2, line 16, the phrase or other medical facilities, so it basically applies only to hospitals. That way it'll help the general practice practitioners and not add more expenses to their facilities. But otherwise, and in the committee report, we will take into account Dr. Palafox's request to refer to his very lengthy addition to the preamble, but we will not add it to the actual bill. We are just going to refer to it on the committee report. Any questions, comments? Okay, seeing none, Vice Chair for the vote on SB 1285.
Human Services members, we're voting on the Chair's recommendation to pass Senate Bill 1285 with amendments. Any objections or reservations to the Chair's recommendations? Hearing none, the recommendation is adopted.
Health.
Health Committee, same recommendation. Vice Chair for the vote. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation is adopted.
Okay, 3 o'clock calendar is adjourned. 3:05.
Who have registered to testify. Your testimony has been noted by the committee and reviewed, will be available for review on the legislative website. I do request a 2-minute maximum oral testimony time limit in order for us to hear all of these bills. So I would recommend, instead of reading your written testimony, if you could stand on it or add any additional comments that you think might be helpful for the committee. So we're going to move into our agenda. SB 283 is first. And I can't find it. This bill relating to health requires Medicaid and insurance coverage of ambulance services and also requires community paramedicine services provided by emergency medical technicians and paramedics. First up, we have DTCA Insurance Commissioner, Mr. Hayashida.
Chair, the department stands on its written testimony and will be available for questions.
Thank you very much. Department of Human Services.
Hi, good afternoon, Chair. The Department of Human Services stands on our written testimony offering comments. I would like to clarify that we are commenting only on Section 1. Thank you.
Thank you, Judy. Okay, also offering late testimony, Department of Health offering comment. Okay, we also have testimony from individuals indicating they would not be present, including AMR, Speedy Bailey in support, HMSA in support, Kaiser Permanente offering comments, the Hawaii County Office of Aging in support, and individual supportive testimony from David Mendonça, Kathleen Sewell, David Kingdon, and Kurt Morimoto, and Michael Lamb. That's all the testimony we've received. Did I miss anyone on the conference? Okay, members, any questions?
No.
Okay, seeing none, we're going to move to the next item on the agenda, SB 310, relating to state licensed care facilities. This requires the Department of Health to post on its website an easily understandable, searchable, and sortable list of all state licensed care facilities with information on their licenses and inspections. Excuse me. First up, we have the Department of Health offering comments.
Thank you, chairs. Appreciate it. This is Keith Ridley on behalf of the department. We do stand on our written comments, and we do appreciate the intent of this bill. We can do what this bill is requesting without this bill, but what we can't do is to do it without any money. So we respectfully ask the legislature to maintain the OCA Special Fund and its current balance and have that available to the department and to the Office of Healthcare Assurance. And I stand by for any questions you may have. Thank you very much.
Thank you, Keith. We also have Dr. Jim Sean offering support. That's all the testimony I can see here. Did we miss anyone on the conference? Okay, members, any questions? Okay, we're going to move on to SB 1019, relating to behavioral health and homeless services. This establishes a state payer committee within the Department of Health to establish uniform baseline performance metrics and evaluation standards for procurement contracts for services related to behavioral health, substance abuse, and homeless services, and other functions. Before we move into the testimony, I would just like to note that I do intend to accept the Department of Health recommended language similar to the amendments that were made in the House vehicle last week. So first testifier, we have the Attorney General's office offering comments. Okay, next we have DHS. Judy?
Hi, good afternoon. Thank you for the opportunity. We stand on a written testimony offering comments, appreciating the intent. Thank you.
Thank you. Next we have the Governor's Coordinator on Homelessness, Scott, offering comments.
Good afternoon, Chair. Support the intent and stand my testimony written comments. And just note that establishing standard performance metrics has had huge positive impact on the homeless sector. leading to decreases in our put-in time count and increases in permanent housing placements. Thank you.
Thank you, Scott. Queens Health System offering comments.
Thanks, Chair. Jason McGonick on behalf of Queens Health. We'll stand our testimony supporting the intent. Thank you.
Thank you very much. Testifying for the Hawaii Substance Abuse Coalition, Alan Johnson.
Aloha, I got my 2 minutes. Thank you. I appreciate this opportunity. ASAC offers recommendations. So today we got a nationwide email from the American Society of Addiction Medicine, ASAM, saying that a coalition of medical societies is urging public officials to create dedicated funds to help people with substance use disorders using evidence-based practices. We know the resources are going down, but let's use them wisely to sustain those evidence-based. So we contend that this payment reform committee will direct the future of behavioral health care. And that's because providers will follow the money in order to survive. So across the nation, ASAM is asking us, will we hold the science and quality care that works, or will we choose strategies that saves money with substandard care? And we know what is science. So over the last couple of decades, 25 billion, one of the most for any illness, went to universities. So we know that the evidence-based care for chronic addiction is primarily residential, followed by outpatient. And we all know that evidence-based care for chronic outreach and moderate abuse is harm reduction, and of course, wraparound services supplements everything. So we presented our thing, the National Coalition's guiding principles to be added to this bill to hold us so that we stay the course of what is best practices. We know resources are going to go down, but let's not sacrifice treatment, especially for the uninsured, the most chronically ill of all, and the federal funding that we receive, that's primarily for the uninsured, primarily for residential. So we list these goals in our testimony. And lastly, HSAC recommends that the Payment Reform Committee be expanded to include a member from the UH Jabson Psychiatric Department, or at least an MD, preferably with someone who has addiction credentials or ASAM designations, because they know what is best practices, and they could advise on that committee. And we present that Hawaii's very own Dr. Bill Haney is the editor-in-chief of ASAM, and he's the one who put out that message today, you know, talking about let's hold the course for evidence-based practices, especially treatment. So with that, we appreciate, you know, our voice and working together. Thank you so much.
Thank you, Alan. Thank you for coming in right at 2 minutes. That's really helpful. Offering late testimony, Department of Health.
Chairs, Vice Chairs, Eddie Mercero, Department of Health. Thank you for this opportunity to testify. We stand in strong support of the measure as it helps us identify who's paying who for what across behavioral health and homelessness services, which, to Mr. Johnson's point, help us identify how best to use the resources in an evidence-based way. So we offer friendly amendments as Chair has identified, and urge you to move this measure forward. Thank you very much.
Thank you. That's all the testimony I believe we've received. Did we miss anyone on the conference? Okay, members, any questions? Okay, we are going to move along to SB 1036, relating to procurement. This is the governor's package bill that repeals the establishment of a community council on purchase of health and human services. First, we have the State Procurement Office in support.
Good afternoon, Chair, Vice Chairs, members of the committee. The State Procurement Office stands on its written testimony and thanks you for considering the revised language.
Thank you very much. That's all. Okay, so that's all. Bonnie's the only testifier who indicated she would be present. I'd also like to note supporting testimony from the Department of Health and opposition testimony from Child and Family Service and the Domestic Violence Action Center. Is there anyone else on the conference who would like to testify? Okay, members, any questions? Okay, seeing none, we're going to move along to SB 1230. This is related to statewide health planning and provides flexibility to deploy statewide language access programs and resources. First up, we have the Department of Health offering comments. Lauren, is Lauren on the call? Okay, next we have testifying for the Department of Human Services,
Good afternoon, chairs, vice chairs, committee members. Joseph Campos, Deputy Director of the Department of Human Services. Thank you for this opportunity to provide testimony. We stand on the written testimony with comments. Thank you.
Thank you very much. Next, we have the Office of Language Access offering comments.
Good afternoon, Chair and member of the committee. My name is Afirat Bambumulan, Executive Director for the Office of Language Access. Thank you for the opportunity to testify on this measure. We stand on our written testimony offering comment on this measure. We also want to note that we understand the current state budget situation. We had a good conversation with BNF, as well as we continue working with the Department of Health regarding our request for an adjustment to the executive budget in terms of budget reduction for OLA instead of budget elimination. In that proposal, we request to adding 2 FTE back to OLA under HTH 908 to ensure that OLA at minimum can maintain our status as an independent agency, and we can continue our function under the statute. Under this proposal, it would allow the function under Section 321C6 to remain being mandatory instead of just a permissive activity. So thank you for the opportunity to testify, and I will be available for any question the committee may have. Thank you, Chair.
Thank you very much. Next, we have Hawaii Friends of Civil Rights, Amy Agbayani, in opposition.
Thank you very much. Also with me is Pat McManaman. She's somewhere in the box there. I don't know that she is muted still. Both Pat McManaman and I have worked to establish the Office of Language Access in 2006, and it's an excellent and necessary and important agency, and we understand there are budget cuts, and we're working very hard to address it, and because we do know that we don't have revenues. But this bill does not help in any way. It actually makes it, it decreases the effectiveness of language access, it makes its duties optional, it doesn't have an executive director, and it may lose its independence and ability. So I don't think this bill addresses really the budget issues that the Department of Health wants to deal with and we want to deal with. And so we respectfully oppose this legislation.
Thank you, Amy. Next, we have testifying for the Hawaii Coalition for Immigrant Rights, Catherine Chen, in opposition.
Thank you, Chair and committee members, for this opportunity to testify on behalf of the Hawaii Coalition for Immigrant Rights to oppose SB 1230, which would reduce OLA and its functionality. Very briefly, OLA's statutorily authorized duties and its independence cannot be optional. Through my work as an immigration attorney at the Medical Legal Partnership, I have heard story after story of clients who did not get timely health or public health messages or contact tracing messages, or who could not access unemployment insurance that they were eligible for, they paid their taxes into, all because of language access. And this pandemic fight is far from over. Reducing OLA now will leave us all weaker in this next critical chapter in the pandemic fight and leave the state paying for it after the fact. We stand on our written comments in opposition. Mahalo.
Thank you very much. Next, we have Pat McManaman in opposition.
Good afternoon. Aloha. For myself, and I think others from the coalition, we much prefer House Bill 728. It is not as far-reaching as this particular measure is. It would leave intact an executive director. It would not make optional mandatory duties, including oversight for non-compliance, as this bill does. It would limit House Bill 728, those functionalities related to the LARC program, and it would also give OLA the ability to obtain grants funds and enter into various contracts that would support its mission. it does not gut the office. I would just echo Catherine's remarks and trust that you'll read my testimony as well, but very briefly, COVID-19 has really shed the light on the abysmal lack of access to language services in Hawaii. In 11 different instances at minimum, the state of Hawaii has either been sued, entered into a consent decree, and in all of those 11 cases with Department of Transportation, Department of Human Services, Judiciary, have been identified as not providing language accessible services, the public has prevailed. And Department of Labor had absolutely no services for LEP people. There was no bilingual applications of form or information on their website. And getting through on a phone call was a wish and a promise, and very often when you got through, you were told the department didn't provide an interpreter, asked to have a child come and interpret, and or inadvertently.
I'm so sorry, I'm going to have to ask you to conclude, please.
I conclude. I stand on my testimony, but just urge this committee also to take this issue to heart. It really is a time of reckoning for race in the United States of Hawaii, and we need to do better by our own.
Thank you very much. That's all the testimony we've received from individuals who indicated they would be present. I'd also like to note the supportive testimony of the State Council on Developmental Disabilities, comments from the Language Access Advisory Council, opposition testimony from the Department of Research and Development, Hawaii County, Catholic Charities Hawaii, and individual supportive testimony from Philios Uruman, and individual opposition testimony from Paul Strauss, Thaddeus Pham, Dina Sheck, and Christy McPherson. Is there anyone else on the conference who would like to testify? Okay, members, any questions? Okay, seeing none, we're going to move to the last measure on this agenda, SB 1375, relating to health. This requires courts and administrative panels in certain proceedings regarding whether a person is dangerous to self or others to consider statements of the person's parents. Testifying first, we have the Office of the Public Defender in opposition.
Good afternoon again. Thank you, chairs, vice chairs, and members of the committees. We may be hang on a second. We may be missing the bill, but it seems it's just that the parents may not appear at the hearings, and instead their written testimony or written statements can be introduced in lieu of live testimony. And if this is so, the statements are just not going to be admissible under the Hawaii Rules of Evidence and under the Confrontation Clause of the U.S. and Hawaii Constitutions. Otherwise, we'll stand on our testimony, and I'm available for questions later.
Okay, thank you very much. We also have Department of Health offering comments.
Good afternoon, chairs and members of the Senate committees. Brenda Bauer-Smith on behalf of the Department of Health. The department stands on its testimony commenting on this measure, and we appreciate the opportunity to testify. Thank you.
Thank you very much. We also have supportive testimony from the Hawaii Substance Abuse Coalition, the Hawaii Psychological Association, and Dara Carlin, and comments from Louis Erschek. That's all the testimony we've received. Is there anyone else who would like to testify? Members, any questions? Okay, seeing none, we're going to move right into our decision making, starting with SB 283. After reviewing the testimony, coverage of community paramedicine is going to require an auditor's report, so I'm going to recommend that we amend SB 283 to require the auditor to conduct a study on whether coverage for community paramedicine should be required. I think it's an apt time, given the pilot project on the Big Island regarding community paramedicine that has been underway for several years. So the recommendation is to pass Senate Bill 283 with amendments. Vice Chair for the vote, Chair votes aye.
Vice Chair votes aye. Senator Moriwaki. Excuse, San Buenaventura.
Aye.
And Senator Favela. Aye. Your recommendations adopted, 4 ayes.
Thank you.
For Human Services, same recommendation, Vice Chair for the vote.
Chair San Buenaventura.
Aye.
Vice Chair votes aye. Senator Ocasio.
Aye.
Senator Misalucha.
Aye.
Senator Favela.
Aye.
Recommendations adopted.
Thank you. Next measure, SB 310. After reviewing the testimony, I'm going to defer this measure. We are going to hear in the Health Committee Senate Bill 1138, which addresses the Office of Healthcare Assurance's request for funds to facilitate this project. The next measure after that, SB 1019, I'm going to actually combine into SB 1036 because, as noted by the Attorney General, there is a title issue with this measure. So for SB 1036, we are going to incorporate the Department of Health recommended language on the payer committee, which follows HB 541 as well, basically adding the Department of Human Services as a co-chair of the payer committee, and instead of establishing and requiring and reviewing contracts to ensure that they meet uniform baseline performance metrics, we're going to amend the language to require this payer committee to track, coordinate, and guide the purchase of behavioral health and homelessness services, and just make recommendations to payers who procure services. We're also going to require that beginning July 1st, 2021, all state procurement contracts for services be reported to the payer committee instead of being required to be reviewed by the committee. And we're going to defect the date as well. And then as it relates to the subject matter in SB 1036, we are going to accept the State Procurement Office amendment. Any discussion? Okay, seeing none, SB 1036 with amendments. Vice Chair, Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela. Aye. An aye vote for you. Okay, thank you very much. Measure is adopted.
Human Services, same recommendation. Vice Chair for the vote.
We're voting on Chair's recommendation to pass Senate Bill 1036 with amendments. All members are present. Any reservations or objections to the bill?
Reservations.
Reservations for Senator Ocasio. Any other reservations or objections? The recommendation is adopted.
Thank you very much. Human Services Committee. Moving to SB 1230, this is the Office of Language Access Bill. I hear and understand the concerns of the advocate community. This is one of those unfortunate measures that needs to keep moving in order to keep statutory compliance with the governor's proposed executive budget. If budgetary changes are made by the legislature to keep the Office of Language Access, then I will happily defer this measure. And in the interim, I'm going to propose that we amend Section 2 of this bill to keep the Office of Language Access requirements mandatory for either the Executive Director of the Office of Language Access or the Department of Health. We're also going to defect the effective date to July 1st, 2050. Any discussion?
No.
Okay, seeing none, Vice Chair, SD1, Chair votes aye.
For Senate Bill 1230, the recommendation is to pass with amendments. Chair votes aye. Senator Baker votes aye. Senator Moriwaki is excused. Senator San Buenaventura.
Aye.
Senator Favela. Aye. Your recommendation is adopted, Chair.
For Human Services, same recommendation. Chair votes aye.
Chair votes aye. Vice Chair reservation. Senator Ocasio.
Reservations. Thank you.
Reservations. Senator Misalucha.
No.
No. Senator Favela.
Aye.
Aye. Recommendation is adopted.
Aye. Aye.
Thank
you
you.
very much. The last measure on our agenda, SB 1375, I think after reviewing the testimony, the first bill on our joint agenda, SB 199, actually more accurately accomplishes the objective. So I'm going to recommend that we defer this measure. On that note, thank you all very much for sticking with us. We are adjourned.
Thank you.